Now let's review the post-traumatic stress disorders and acute stress disorders. Realistically, both of these disorders are identical in that both of these disorders are individuals who've been exposed to a horrible stressor. Things like floods, hurricanes, war, rape, and of course, the trauma of 9/11. These are individuals who have either witnessed it or who've actually survived it. These are individuals who, while they were there, thought their lives was in danger, thought that something horrible was going to happen. So as a result of that, these individuals are going to have specific symptoms that are usually seen in either ASD or PTSD. Now the symptoms are identical. The stressors are identical. So what is the difference between ASD and PTSD? The only difference is duration of symptoms. For you to be diagnosed with acute stress disorder, you must have the symptoms for less than 1 month. For you to be diagnosed with post-traumatic stress disorder, I should say, you must have the symptoms for more than 1 month. So look at the time frame of how long the patient has been presenting with these symptoms, and that will determine whether it is ASD or PTSD. Many individuals who develop these disorders also have premorbid conditions. For example, many of them abuse drugs. Many of them have personality disorders. Many have been exposed to childhood trauma, or they have external locus of control, which means that they believe that they are not in control of their situation. It's fate, it's luck that determines their destiny. If you're that type of person, then you are not in as much control of your life as someone who has an internal locus of control. So therefore, people who have these kind of problems are more likely to develop PTSD. Let's look at the presenting symptoms of patients who have PTSD or ASD. Even though PTSD or ASD can occur in any age group, you tend to see it more frequently among the very young and the very old. And why is that? It all has to do with support or your perception of support. The very young have all the support in the world, but what's the problem? They don't know how to access the support. The very old know how to access the support, but what's their problem? Their support system is gone. And that is why those two groups are at highest risk to develop PTSD and ASD. As far as when this occurs, most of the patients who develop these disorders, their symptoms occur immediately after the trauma. What makes PTSD difficult is that months to even years can go by before these patients start to develop these symptoms. Now, the three main symptoms that you typically find in PTSD or ASD, the first one is the re-experiencing of the traumatic event. So what happens? Let's say you were raped. You constantly have nightmares about the rape. You constantly have flashbacks about the rape or intrusive recollections of the rape. And that is essential in the diagnosis of this disorder. You're going to experience something called phobic avoidance. So let's say you were raped at school. You might drop out of school altogether and you'd never want to go to school. Why? Because anything related to school will remind you of the rape and you're going to avoid it at all costs. And of course, you're going to have anxiety symptoms, a lot of arousal, sleep disturbances, an increased startle reflex, concentration difficulties, etc. Patients with PTSD need constant counseling. The quicker the counseling, the better the prognosis. Most of the times when something traumatic happens in the United States, you realize that counselors are made readily available, trying to counsel the individuals who've experienced these stressful situations so that the likelihood of PTSD occurring will decrease. If you do have therapy, group psychotherapy is probably recommended. And as far as pharmacotherapy, any kind of antidepressant or anti-anxiety medication will be the treatment of choice. If given a choice, probably pharmacotherapy will be the treatment of choice for the treatment of PTSD or ASD.